Okay, class, today we have Eddie here. Eddie is 10 years old, all right? He has joint pain and stiffness and periodically a low-grade fever, okay? So he's had these issues for the last 8 weeks. So he complains of stiffness in his joints and he's having swelling in both knees, all right? So it's been very, very difficult the last few weeks for him to play baseball, and he wants to be part of his little league team. So it's been very, very stressful for him. Now the pediatrician has come in and has checked him out and ordered some lab work. His WBCs are within normal, but he has an elevated ESR. Okay, he has been ordered naproxone, 150 milligrams by mouth, BID, so twice a day, and 15 milligrams of prednisone by mouth, BID. Okay, so can anyone tell me a little bit about the pathophys? And let me get you started on it. Juvenile rheumatoid arthritis is it's an arthritis that occurs, and it is your body's immune system that is fighting or attacking its own cells and tissues, particularly the connective tissue, okay? And it likes to inflame the synovia, okay? And can anyone go any farther?
I can.
Okay, Miss Monica.
Hi, Professor Gill. So I found the answer in my book. It basically says when the synovium becomes inflamed, that excess fluid is produced and that there's a thin and watery, so that it's thin and watery. The tissue swells and granulated tissue can form. As it deteriorates, the cartilage and bone become damaged, destroying the joint. Heredity and environment seem to play a role, and it's considered JRA if it's persistent joint swelling in one or more of the joints greater than 6 weeks.
Awesome, awesome, great job, Monica, for looking that up. Okay, Eddie, do you know why you're prescribed naproxone and prednisone?
Well, my mom always tells me to take a lead. Naproxen is the first line of treatment for JRA. It's an anti-inflammatory, non-steroid medication.
Awesome, and what about prednisone?
Prednisone, I take that too. It controls the symptoms to prevent complications such as inflammation of my heart.
Oh, so it's preventing pericarditis.
Yeah.
You know your drugs. That's an awesome job, Eddie. Thank you. Okay, so can anyone tell me if these dosages for the dosages for Eddie are appropriate?
Oh yeah, I could do it.
Okay, Myra.
Professor, I actually did them here.
Oh, you did?
Yeah.
Okay, let's see what you've got here.
Okay, so we'll start with Eddie. He weighs 66 pounds or 30
Oh,
kilograms.
yes, I did that, yes.
Yeah, so for naproxone was ordered 150 milligrams by mouth twice a day. The dosage calculation is 10 milligrams per kilogram per day, twice a day. So the maximum is 300 milligrams a day.
Perfect.
Or 150 milligrams twice a day, so it is safe.
Okay, and then prednisone I see you've got here.
Yeah, so that was ordered 15 milligrams by mouth twice a day. The dosage calculation is 0.5 to 2 milligrams per kilogram per day.
Okay, yes.
And it can be given 1 to 4 times a day. The minimum dose is 15 milligrams a day, and the maximum is 60 milligrams a day. 15 milligrams twice a day equals 30 milligrams, so it is safe to give as well.
Perfect. You did an awesome job, Myra. I am so
Thank you.
proud of you. Okay, so since Eddie does weigh that and he has, if these drugs are appropriate, can anybody tell me what some of the adverse reactions and maybe some of the nursing interventions that might be, that Eddie may need to be aware of?
I found it.
Okay, go for it,
Okay,
Maria.
so for naproxone, some adverse effects are GI bleeding, any edema, headache, tinnitus, dizziness, and you can also have a prolonged bleeding time. So for this, some interventions, you would probably want to take this medication with food or milk so you don't have an upset stomach. And also you want to monitor any signs of infection. It is going to be masked, so by that you should check your white blood cell count and also check your temperature. And for prednisone can cause an increased cranial pressure, hypertension, nausea, decreased wound healings, and Cushing syndrome.
Cushing syndrome.
Cushing syndrome.
It's
My
okay.
mama didn't tell me all these things.
That's okay. That's okay. So go ahead, Maria.
So you would want to continue to monitor your renal status because it can cause renal insufficiency.
That's your kidney.
Okay.
monitor your input and output, so when you go to the bathroom and what you eat, and your daily weight, because Cushing's syndrome, what it does, it causes edema, so it's going to cause swelling. So then also your nurse or your doctor will also take lung sounds to hear for any cracklings or dyspnea. And also you're going to monitor your glucose. They'll check your glucose, your sugar level, so you don't have hyperglycemia or hypokalemia.
Hypokalemia can cause your heart to do different things like arrhythmias.
As long as
and
I can
stuff.
play baseball.
Yes, I know, Eddie. So why do you think Eddie has been stressed out about his baseball?
I know why he's stressed out. He's stressed out because he's worried he won't be able to play baseball because of his pain. But it's okay, you can still play baseball as long as you take rest breaks to increase your endurance and to limit the joint impact throughout the day. You're at risk for impaired mobility, or he's at risk for impaired mobility, and needs a program of proper rest, proper positioning, and gentle exercise.
Gentle
So,
exercise, yes, but that doesn't mean that you can't play baseball, Eddie, so that's okay. So now, let's take this a little bit further. So Eddie was doing well on his medications and he had limited discomfort. But now today, he's experiencing a very, very acute, painful joint episode. Can anyone tell me what would be the best intervention during this acute episode? Or maybe Eddie, what do you do when your pain acts up on you?
Well, my mom always tells me to take hot baths or showers. I like the showers.
Yeah, most boys do.
Yeah, and she told me to use a whirlpool too, or hot packs.
Hot packs, that's a very good.
That would reduce my joint stiffness and increase the elasticity of the tissue around my joints.
Okay.
She also said if splitting may help to rest the joint, to reduce pain and align the joint in proper position.
Okay. So, Klaus, what can Eddie do to help his musculoskeletal integrity when he's not experiencing a painful episode?
Oh, I can tell you.
Okay.
Well, Eddie can help his muscular skeletal integrity by making sure he doesn't over-exercise, take his medication on time, rest often in between of activities, and have a good diet. High in fiber, protein, calcium, and drinks a lot of fluid. Stay hydrated, Eddie.
I'll try.
Okay. So, are there any special concerns that Eddie needs to be aware of if he was on a SARD therapy?
Yes, Eddie and his mother should be aware that SAR are slow-acting anti-rheumatic drugs that are used in children who have incomplete response to their combination of therapy of NSAIDs and steroids.
Okay, anyone else?
I can add to that.
Okay.
They also cause bone marrow suppression, so they become anemic, thrombocytopenic, which is low platelets, and a risk for infections due to low WBCs.
Okay.
They also cause oncogenicity,
That's
which means they produce tumors.
Okay, so Klaus, what are some other important teaching issues that maybe Eddie and his family need to be aware of?
Okay, I'll start with that one. So you want to be alert for guarding of jointing of the pains, refusal to bear weight, limping, and any facial expressions or signs of discomfort.
Okay, anyone else?
He may be fussy and irritable in the morning due to the stiffness in his joints.
Okay.
Well, you also want to watch out for weight loss, anorexia, or failure to grow.
Okay.
And parents need to be involved with as many nursing activities as possible to reduce anxiety and increase the sense of control over situations.
Okay, anyone else?
Yes. He also needs to make sure that he has regular ophthalmologist visits to check his eyes for inflammation.
Okay, so you guys did a great job. I'm so proud of you. You guys know your arthritis very, very well. Eddie, do you feel a little bit more comfortable now? Do you want to go play baseball?
I sure do, but I need to make sure that everybody in my community knows about JRA.
Okay.
That way I could live a normal, developmentally appropriate lifestyle.
That is perfect. I am so proud of you, Eddie. That was awesome. Klaus, you did a great job.
Yay!
That's it.